This video will demonstrate how nurses can use the Family Preferences Index to determine specific areas where family caregivers may want to be involved in the care of their older adult family member.
My son is a 77-year-old female who they reported some confusion in ER, but she seemed pretty appropriate to me. Fell at home, possible hip fracture, insulin dependent diabetic, and Teresa has recently moved back closer to her mom because of several falls over the past few months. And so Teresa is kind of taking over the primary caregiver role and stepping in to help her mother. Hi.
Hello.
I'm Kenny. I'm going to be your nurse today. I have a nursing student here, Nick, with me.
Hi there.
And it's Mrs. Hahn.
Mrs. Hahn.
Nice to meet you, Mrs. Hahn. You are.
I'm Teresa. I'm her daughter.
And are you a primary caregiver with her, or does...
Yes, I take care of most of the things that she needs at home.
Well, good. It's nice that you have somebody here to help you, huh?
Yes, it is.
So right now you came into the emergency room after a fall at home, huh?
Yes.
And you're having some pain?
Well, they gave me something down there to help, so
Okay.
I'm feeling pretty good.
Because we're going to have you go downstairs and have an x-ray of that hip, make sure it's not fractured.
Okay.
And I just want to make sure you're comfortable before you go downstairs. Yeah.
I am right now.
You are right. Good. And so when she goes downstairs, Teresa, I'd like to ask you a few questions to put together a care plan for her, kind of personalize it. Because she fell at home, we put her in this teal gown and put an alarm system on, and there's also a sign outside. And our staff is aware that that means to pay a little more attention, that she's a fall risk.
Oh, good.
And,
that makes me feel better.
And we don't want her to get up at all without help. If you do, Mrs. Hahn, push the red call button to call for me, or if you do get up without help, you'll hear an alarm and just wait, and somebody will come help you, okay?
Sit back.
Yes, ma'am. We don't want you to get up without help.
Okay.
All
She
right? We
will.
just don't want you to fall again and injure yourself any further.
Okay.
Thank
So
you.
we'll be
Thank
back
you.
in a few minutes when she goes, and we'll go over those questions.
Great. Thank you very much.
So Teresa, here at Providence St. Vincent's on the medical floor, we really like to use the primary caregiver and help design a plan of care for your mom, an individualized plan of care.
Okay.
So these next few questions will help me get to that plan of care, okay?
Okay.
And are there any concerns you have right now about your mom's hospitalization?
Yeah, I do have some concerns about her. She's fallen now a few times at home, and I really don't know what this means for her future care, what things that we may need to change at home. Those are my main concerns for her right now.
So at this time, you said that you're your mom's primary caregiver. Do you live with her, or does she live at home alone? Or?
She does live very close by where I live. I live within a few miles of her, and I do check in on her frequently. But I've just moved back now to live closer to her since she's continued to have these problems with falls. Yes.
Yeah. Well, let's go ahead and get into the questions, and this will kind of help develop this care plan. If there's anything you want to say, just let me know.
Okay.
And so we'll go through it. So you moved up to be around her. Now, while she's in the hospital, can you be here, or what's your schedule like? Would you like to stay with her while she's here?
Yes, I'd like to be with her as much as I can while she's here, although I do work during the daytime.
Okay.
I plan on coming usually at about 5 o'clock
Okay.
and spending as much as the evening with her that I can.
Now, the second question kind of involves keeping your mom linked to the outside life of the hospital, and I heard you guys talking about her dog and that you're already willing to help with the dog and mail and stuff. And can you also like notify friends or any social groups or stuff like that, kind of be her in between while she's here and resting, getting better?
Yeah, actually my mom does have a little dog that she just loves, and I would like to be able to bring the dog in. Is that possible here?
Well, we do have a pet policy here, and so after we get through this, we'll discuss it, and I'll show you the policy and see if that works out for us, okay?
Great, thank you.
So the next question is would you like to do activities while you're here with your mom, watch movies, or just play cards with her?
Oh, yes.
Crossword?
She loves to watch movies, and that's one of the things that we do together a lot at home. So that would be wonderful if we would be able to do that here.
Yeah, we have a DVD player here that we can bring in if you don't have one from home. The next question is about emotional support, and so it would be in a sense of you providing reassurance and emotional support to your mom.
Definitely, yeah. We are very close, and I want to be here for her as much as possible through this hospitalization. I know that at times she can get kind of scared, so it's my goal to be here throughout as much of this as possible.
Engaging in religious practices and praying with your mom, and are those things that are important to your mom, and would you like us to help you provide with a chaplain, or would you like to be the one to meet her spiritual needs while she's here?
Yes, actually my mom would definitely love to take part in communion once a week if you offer that here.
Yeah, we do. We have a hospital chaplain.
Great. She would love to do that then. Thank you.
I will definitely set that up for her, okay? Now, this is just kind of a task-related question, but bringing and taking things to and from the hospital, your mom may want some fresh clothing or a gown. We make it flowers delivered, and or have soiled clothing from today coming in through the ER that may need to go home.
I'll be checking in, like I said, every day and bringing her the things that she needs from home, taking things back that she doesn't need, and doing that daily, so that's no problem.
But also, this next question leads to moving and bathing, toileting, and dressing. And so how do you feel about helping with that kind of stuff?
I would definitely like to participate in her care. Like I did say, that I won't be here most of the daytime because I do work, but I'd like to come in and help with her evening care.
Also, I need someone who can provide information to the healthcare team about your mom. And are you willing to do that? I have an admission data form is what I like to use.
Okay.
It has medical history, medications, family history. Are you willing? Okay.
I'd be happy to fill that out.
Well, thank you. Would you like information from us on how to take care of your family member and treatments that we're doing?
I definitely would like to learn about the things that I'm going to need to do to participate more in her care, because it does appear that she's going to need more care from this point on. So I would like to learn about anything that I can learn that would make it easier for her.
Okay. I noticed that your mom has diabetes, and so
Yes, she does.
Do you know anything about diabetes?
Not a lot. My mom has been taking care of her diabetes at home independently up until just recently. So I am going to need some information about that so that I can take over in helping her.
Well, this will really help us develop a plan, and regardless of diabetes or medication management, I think that we'll have some good tools after this for you.
Okay.
Okay? So the next question that we're going to get to is to make sure that you're involved in helping the healthcare team make the correct decisions and meeting your mom's needs. And so when I say needs, I think that at this point, that's going to be with the recent falls, does she need some strengthening? Does she need safety eval? We'll find out if her hip is broken or not, and what to do for safety. And then all of these questions kind of relate to this question, but it's participating in the medical and nursing treatments for your mom.
Oh yes, absolutely.
And that takes us into our next question, which is if you're willing to or participate in working together with the healthcare team at the end. And what you'll find in this is that you may get phone calls from the doctor letting them know how they are, especially if it's surgery. The surgeon will definitely want to contact you and talk to you. You may also get a call from a care manager or follow up on what do we do after discharge with your mom. And this is very important. Does she have to go to rehab? Is she going to be under care of you? Will you take time off work and stay with her at home? And so this is where we really want your participation, if you're willing to, in developing this plan of care for that, for the discharge planning.
Oh, yes, absolutely. I'll make sure that you have all my information, and like I said, it will be just in the evening time that I could be here. On the weekends, I do plan on being here if she's in the hospital that long.
There's also a question here that's participating in decision-making about my family member's care. When you are participating in decision-making, and if, let's say, your mom did have to have surgery, if the hip is broken and something happened during surgery, or the medication left her a little bit confused for a day or so, which is common with your mom getting pain medicine. Are you the power of attorney at this time, or does your mom still act as her own healthcare decision maker?
Up until now, my mom has made all of her decisions about those kinds of things for herself. She's been very independent. So I think that given the new circumstances, that we probably need to take a closer look at what we're going to be doing about those things. And my brother and I need to be talking about making those types of decisions with my mom.
And so the last question on this, besides if you have some questions for me and kind of reiterating on what I do know from my experiences, is when you have a family member at the hospital, it's often hard to remember to take care of yourself. And so you think you'd be able to take care of yourself while your mom's in the hospital also, and stay rested and so that you can function and help?
Well, like I said, I will be working still full-time while she's here, and then coming to the hospital right from work every day that she's here in the hospital. So I may end up getting a little bit tired, I'm sure, but I'm going to do the best I can to take care of myself.
Now, are there other brothers and sisters that you have or close family members that would like to also participate in her care?
Yes, actually I do have a brother. He does not live as close by though as I do, but he will be checking in periodically on Mom while she's here, and getting updates from the nurses, if that's okay.
Good. Yeah, that'd be a good rest time for you.
Yeah.
Great.
You think your brother would like to be here during the teaching for diabetes, how to manage that, or some of the getting up and walking, the safety issues?
Oh yes, definitely. I think it would be a great idea to have my brother participate in that. It would be a big help for me also to have somebody else know how to do those things as well.
I agree. The more help you have, the better it'll be with your mom. Yeah, and if there's a night that you feel like you need rested, or anytime you want to call and say, I'm not going to make it, this plan of care can be changed. You know, the nursing staff is always here to help.
Okay.
Your mom too.
Thank you.
Okay?
Great.
I like the Family Preferences Index for how it involves the family in their loved one's care. It really brings them into this covers every aspect of what's going on in their care, what we're planning, and what's really the big picture of what's going on in the hospital, and it lets the family members in on what we're used to seeing every day.
I really like the tool, and it gives you a defined answer. So Teresa, as you noticed, was able to tell us exactly what she wanted, and I think it made her feel reassured about her mom's care and her wishes.
Great. And Teresa was really involved, and she sounded like she really wanted to help a lot with her mother's care. What happens when you get a family member that doesn't have the time or the will to really put that much effort into it?
Often we have family members that aren't able to come and aren't able to help, or we have patients that come without family altogether. And in that scenario, our goal is that when there is a family member here and who can help or who is a caregiver, that we use them, we give them the opportunity to get the education they need, if they need any, or we take the education they have about knowing about that family member and we utilize that in the plan of care. And so that's the goal out of this index, is to help the family member help in the situation. But if we did the same care, and you know that as a student, we did the same care regardless of involvement.
Why do we do the Family Preferences Index when the patient is not in the room?
And that's a good question, because we always include the patient in everything we do because it's their thing. But this offers the caregiver or the family member, son or daughter, a chance to honestly answer and be candid with their remarks about what they think is going on with their parent, whether it's declining and they don't want to talk about it in front of their parent, or that they don't want to help, or they don't have the time to help. They have a family of their own to raise at home, and so it allows them to be frank and honest, and not feel like they're put on the spot in front of their mother or father or loved one. Teresa's very concerned at what point and where are we at right now, because at home, mom is independent. Mom showers, mom takes care of meds, and now if we have a broken hip, what is she going to be able to do?
So we need to explore that with her.
Yeah, and
with
if
Mrs.
it's
Hahn.
broken, what are we going to do? If it's not broken, what are we going to do? Safety, rehab. I mean, Teresa works all day long, so she wouldn't be home. The other few questions are regarding to her being our go-between for the family and finding out healthcare information, that she wants to be involved in treatment. She seems very willing to help. Very nice lady. So there's no active power of attorney at this time, and so I will give her information. She said her and her brother would explore this information. I'll give them our advanced directive book when she comes back to you. And then some diabetes education for both of them, all the way how to give, draw it up, check the blood sugar, and administer.
Is that something that Mrs. Hahn's familiar with?
Mrs. Hunt is, but Teresa's not.
Okay, so we'll
So
plan.
we'll need to work with Teresa while her mom is in the hospital, and then we can also liaison with the diabetes educators outpatient and get Teresa engaged in that as well.
Yeah.
And also the mobility aspect. If she should be going home, teaching her how to help transfer using any equipment, that type of thing. So we'll just
Right.
need to keep that kind of on our to-do list
And
if we need to do
regardless
that.
of surgery, or if it's just a bruised hip, I still think a home safety eval, or if we've had a couple falls.
We can, I think, safely assume that the long-term trajectory will be some decline in functional ability, even if there's not a fracture, just given the recent falls. So I think that's a prudent approach to take.
Anything else, Kenny?
Her idea of having her brother involved, and Nick promoted the idea of teaching insulin and stuff, so that if she wasn't around or she needed some time off, that we have a backup family member that can help.
Okay, so
So-
we'll, just in all of our planning, then we'll make sure that we include both
Yeah.
son and daughter in making sure that they can provide care.
Yeah, I think if we get Teresa, no matter what, trained in all of it, but if we can involve the brother in most of it, I think that would be the best outcome.
Should we go ahead and summarize the things that we want to follow up on now, things that we can put on the back burner, but keep it in mind that we may need depending if she has surgery or not?
I'll begin the process of working with Teresa and the nursing staff to provide education on checking blood sugars and administering insulin while she's here in the hospital, and I'll also make that referral to outpatient diabetes education for her for when her mom discharges.
Okay. And then for physical therapy, occupational therapy consult, have we gotten an order for that as just getting a baseline on mom after she comes back from x-ray?
Yeah, I would have to look at the chart again to see what was ordered, because she went right to x-ray. But if not, we'll make sure we get an OT-PT consult right away.
And what I can do is make a referral to the discharge planner and explain the situation that Teresa is wanting to be actively engaged in mom's support. And then once we do receive a physical therapy, occupational therapy consult, that we'll speak with them and make sure they understand that the daughter Teresa and her brother both want to be involved, to make sure that they are comfortable with providing mobility, transfers, those kind of things if she was to return to home.
So Kenny, you're going to pull up the PET policy so we know about the information to give Teresa if the dog can come in and visit mom when the time's appropriate, or if it's appropriate for that. And also, you did say that you contacted pastoral services, because I know that Mrs. Hahn was concerned about the communion, and even though she's MPO right now, then they can be checking in to see if they can offer communion to her.
That is correct. Pastoral services will check in with us. I told them that she's gone for x-ray, but wanted to let them know what she needed. And then the dog, depending on the situation, I'll discuss further with Teresa about the dog.
Anything else?
Is there anything you need from us that we can help you, at least from my role?
At this point, I think we just build this plan of care here, and then I'll look back into it and call the meeting together again if I feel like we need it. It all depends on x-ray and if the hip's broken.
Well, just let us know what we can do to help you.
Okay, I think we've got a good start.
The number of family caregivers in the U.S. depends on what definition you use of family caregiver. And so the range is very broad. But for older adults, we estimate that there's approximately 60 million family caregivers. Most of those caregivers are women, at least 67%, although that's starting to change over time. More men are becoming family caregivers, and then there are also a different range of people other than, daughters and wives who are caregivers. But predominantly it's women. A lot of those women are caught in what's called, the sandwich generation, where they're also employed and they may also have caregiving responsibilities for younger children. And they provide a considerable amount of family care in the homes. Some estimates as high as 29 hours per week of care that they deliver. So our healthcare system, and particularly our community care for older adults, is highly dependent on family caregivers. When an older adult gets hospitalized, at least many years ago, we didn't necessarily think about the family caregiver and incorporating them into the care plan for the patient. Some of the research that's been done on family caregivers and what level of involvement do they want to have in hospitalized care has led us to find that they're actually quite a bit more worried about what's happening with the older adult. They're interested in being involved with care, but they're afraid that they're maybe going to be in the way or that their contribution's not going to be welcome. They're also concerned that maybe they don't have the skills, to participate in the care. And so this whole atmosphere of maybe wanting to be involved but not knowing how to do that and not feeling invited to do that creates a lot of stress and worry for the family caregiver. And that's particularly true when, the older adult may be changing in terms of their level of ability to be able to, care for themselves. One of the things we know is that when older adults are hospitalized, a lot of times they lose functional ability. So they experience like a functional decline that, then the family caregiver is going to be expected to make up for when they either return home or if they should have to move to a more supported living situation. We also need to recognize too, though, because family caregivers do, provide so much care and they're under so much duress a lot of times. For some of them, when the older adult comes to the hospital, it's maybe their only chance to get some much needed respite care. So there's a real balance here between inviting and encouraging family caregivers to participate in care, but also being careful to recognize or not put pressure on when they may not feel comfortable in doing that, or may have a reticence about some particular aspect of care that they're not comfortable providing. And that's one of the things that the Family Preferences Index, gives us the opportunity to engage in a structured dialogue with the family caregiver about what their preferences are about participating in care. There's more and more research that indicates that some of the dangerous times for older adults are when they transition from one environment to another. So going from the hospital back to home, or going from the hospital to maybe a new care living type of situation, or going to a rehab environment, is a place or a time where important things don't get communicated to the new caregivers. Important information about the older adult and what their needs are may not, make that transition with them. And so we think that having the family caregiver involved in the care during the hospitalization and being an active participant and partner in the delivery of that care and the planning of that care is particularly important when it comes time for the older adult to transition out of the hospital environment. What we see now is that nurses are a lot more attuned to thinking about that planning ahead, and so that again is a good reason to involve the family caregiver in that collaborative care while they're in the hospital environment, because it's a good time to find out what are some of the preferences of the older adult, what are some of the things that might need to be taken into consideration when we make those discharge plans, and what are some of the strategies that are going to work well for them, and get that information to the discharge planners, and a lot of times also communicating that back to the provider who's going to be doing long-term follow-up for the patient when they return back to the community environment. Because that provider may not necessarily be aware of some of those pitfalls that that person's going to encounter when they return to either their home situation or to some rehab or long-term care kind of environment. Although you can give the instrument to the family caregiver and ask them to fill it out, the real benefit of using the instrument is for the nurse to actually sit down and have a dialogue with the family caregiver about the responses that they're giving. And it's in that context of getting those details that the nurse can really do a couple of things. One, start developing that collaborative relationship with the family care provider, gain a lot of in-depth knowledge about the older adult that wouldn't be accessible to them in any other kind of source of information that the older adult might be bringing with them. A lot of times the family caregiver has knowledge about some of the limitations in functional ability or other things that would be key in terms of planning care. And the Family Preferences Index, and when you're going through that and finding out from the family caregiver's perspective, would you like to be involved in, providing some of their activities of daily living, their bathing, eating, etc. You're going to start learning details about the patient that are really going to enrich your ability to provide a really individualized plan of care. The Family Preferences Index, you can be covered in a relatively short period of time. I would say maybe 15 to 20 minutes. That may sound like a lot of time, but what time you might be able to save later in terms of the discharge planning process and, in terms of developing a relationship with the family caregiver that's going to really make the rest of your work so much easier, I think it's worth the investment of time. The Family Preference Index was really developed as a nursing tool and meant to be used by a nurse to be able to bring that nursing perspective and that ability to, ask probing questions, to really synthesize information, to be able to then, put that information to the plan of care. From my perspective, I think it's important that the nurse actually either administer the interview or go over the results of the interview with the family caregiver. The Family Preference Index is probably best administered if you can do it immediately after the person has been admitted. But there may be other times when it might be important to go back and recheck the answers. Like, for example, if there's been a dramatic change in the status of the older adult. Let's say somebody originally came in, they were stable, but now they've developed maybe some sort of an end-of-life type of situation, and their functional ability and their prognosis has really changed dramatically. That might be in a time when it might be good to go back and revisit those preferences. And during an occasion like that, it might be that some new family members have entered the picture, and so it might be good to go back and still double-check if the preferences are the same. I think if it hasn't been administered up to a certain point and you're coming closer to a time frame when the person's going to be discharged, especially if they're going to be discharged into a new living environment, I think it would be good to, if it hasn't been used up to that point, to do that, because one of the things that the tool really helps both the family and the nurse think about is that kind of transition into returning home or to a new living situation. The Family Preference Index it was originally developed to be used in the hospital environment, but it's certainly not limited to being used in that environment. Certainly like a skilled acute kind of setting, a rehab setting, or for that matter, home health nurses could use it as a guide, in their care planning in terms of, what the family caregiver's preference might be to be involved in care that's going to be delivered at home. I think the thing that's important with the Preferences Index is we want to be open to and be in partnership with the family caregiver. So it may be that for any number of reasons, they may not want to be involved with a large share of the care that's occurring in the hospital or whatever setting the older adult's in. And what we want is, as I said, this tool to be an entree into being able to dialogue with the family caregiver about what their preferences are and to be accepting of whatever those preferences may be. There may be very good reasons why the family caregiver has a lot of limitations around the level of involvement that they want to be part of in whatever setting that the older adults have. And we want to be sensitive to that, and we also want to make it an accepting environment so that they can express those kinds of reservations. It might be that the reservations are fears around having the skill to be able to manage that kind of care. And should you discover that, that would be an important thing to address in the teaching that we would be doing with the family caregiving. Some of the other challenges that might come up with the Family Preference Index is initially when you look at the tool, it looks like it's intended to be done with one primary family caregiver. And one of the things we do know is the idea of a primary family caregiver is somewhat of an artificial construct that we've come up with, with people who do research on family caregiving. And in many families, care activities are divided among different family members. One of the things that can come up as an issue is there may be conflict between different family members about what the direction of the care should be and who should be doing it. So that can be a challenge. One of the things, though, that I think is a benefit of having that tool is it does make us think about asking the family members and family caregivers, what they want their particular role to be, and they'll probably tell you if, well, for example, my brother does not want us to withhold life-supporting treatment, and should that occur, he's going to feel really strongly that every available, intervention be done. And so being aware that there may be those internal family conflicts and having the confidence of the family so that they are sharing that with you. With some cultures, there may be certain inhibitions about different gendered caregivers being able to do certain tasks. But then again, I see that actually as a benefit of the Family Preferences Index in that we ask about that ahead of time and we highlight those issues so that we're not making assumptions about what some of the family caregivers will or will not be willing to do. The other resources that I would recommend are the AJN companion article. And in that article, we have information, again, about using the tool and apply it to a specific case situation. There's also the website where the Try This information is located, and that's an excellent website. The Hartford website has the Geri consult nurse, and I often recommend that to undergraduate nursing students as a good place to get information about the care of older adults.